Having tightness or pain in your jaw? Then you've come to the right place. Check out this video. Hi, I'm Dr. Joe DeMarco, chiropractor and owner of OcraMed Health, and today we're here talking about a common thing that affects a lot of people, tightness and pain in the jaw. Oftentimes it can lead to some temporal headaches. First off, before we even get into it, if you're experiencing severe tightness and severe jaw pain with headaches, definitely want to get to your doctors, have them check you out first, and then come back and watch this video. So I think that covers my disclaimer. Okay, here we go. Jaw pain. What are we talking about? We're talking about what's commonly known as the TMJ, the temporomandibular joint. We're never saying that word again, or those words again, the TMJ. Now, first off, I got to tell you, one of my pet peeves, I cannot take it when patients come into my office and they say, Dr. Joe, I went to my doctor and he told me I have TMJ. That's like someone saying to you, you got knee or you got shoulder. The TMJ is the name of the joint. You might have TMJ syndrome or something like that, but I can't stand when doctors tell patients that they have TMJ. I mean, like I said, it's like saying, you got knee, you got shoulder. I mean, that's the name of the joint. So there's my pet peeve. I'm off my soapbox. Okay, so here we go. Why are we running into so much trouble with the TMJ? It's one of those things, and I'm going to give you a couple different scenarios why people run into problems with it. You got that group of people that are the people that are just stressing at work. Their shoulders come up, they get tight, they're clenching on the jaw, and they're doing it all day long. Those people develop a lot of TMJ problems. But, this is a fitness-related, therapy-related channel. And a lot of the viewers are people that like to work out, so I'm talking to you now. Why do we run into problems with TMJ? You think about, or next time you're in the gym, concentrate on some of the lifts that you do. Are you clenching your teeth on some of your lifts? I know several years ago I was totally guilty of this. Someone brought to my attention, I was at a powerlifting seminar, and someone brought to my attention that when I was bench pressing, I was clenching down on my teeth as I was pressing, bench pressing, as I was making the pressing motion. And I didn't even realize it. And you probably are doing things in the gym that you don't realize that when you're forcing and you're stressing either deadlifting or squatting or bench pressing, there's probably certain movements, maybe not on all of them, that you're probably clenching your teeth. So you got to catch that stuff. And if you're doing it, you got to stop. So years ago I stopped. It took time. It's not the easiest thing to do. It was a habit I had of clenching down on my teeth when I bench pressed. I stopped doing it. So be aware of that when you're in the gym next time. Are you clenching your teeth when you strain on certain movements? Okay. So whether it's at the office, at the desk, or in the gym, tightness develops in the TMJ. We end up with pain. Before we go any further, and we're going to keep this real simple. The TMJ and the musculature around it is actually very complex. But we're going to just keep it very simple because I want to give you guys some real simple stuff to do at home so you can help yourself. But let's take a quick look at the basic anatomy. The temporomandibular joints are the two joints connecting the jawbone, or anatomically known as the mandible, to the temporal bone of the skull. This image shows the two primary muscles that close the TMJ. We have here the larger of the two and the stronger of the two, the temporalis, and the second muscle is known as the masseter. The muscle that primarily opens the TMJ is known as the lateral pterygoid, and it's only partially shown in this image as it is a deep muscle of the TMJ. Okay, so as you can see, the two main muscles that we're dealing with that actually close the jaw that we use all the time when we're clenched out of the teeth is the temporalis and the masseter. So those are kind of the two of the main muscles we're going to focus on today as we do some work on this. Like I said, there's a lot of other muscles that assist, but those are the two main muscles. Motions of the jaw, it's a very interesting joint, the TMJ, in the sense that you have one on each side and they work in conjunction, and you really can't think of a lot of joints or any other joints that do that. In other words, like for example, your elbow joint. I can flex my left elbow as I extend my right elbow. They work independently. But the TMJ, your left and your right, work together. You can't open your left jaw as you close your right jaw. So it's an interesting joint or two joints that work in synchronized together. They open together, they close together. What is the joint is also interesting in that when we open our mouths, the joint, the mandible doesn't just come down. It actually, and you could feel it if you put your fingers at the top of the mandible, as you open your mouth, the joint actually, the mandible comes down, and the junction here actually slides forward. So we actually have like a sliding motion forward as the jaw opens, and as the jaw closes, the mandible comes up and it retracts back this way. So ranges of motion, we can close the jaw, we can open it. Then we can also do what we call protraction, which is jutting the jaw forward and then retracting it back. I know this is a bad view for an Italian from Boston, having a close-up on my jaw, because I know everyone's making fun of my nose. I don't care. What can you do? So protraction, retraction, and then of course, looking from the front, we can go slightly side to side. So let's keep that in mind. We're going to start on some fascial release work first, then some simple ranges of motion, some simple exercises to get this jaw feeling better. So let's go. All right, so remember, we're dealing with a small joint, very thin muscles. We're not trying to work in the glutes. We're not trying to dig into this tissue crazy. Our tool, we're just using knuckles. We don't need to use a Tai Chi ball or anything like that on this type of an area of the body. It's thin muscles. You want to do everything I'm going to show you. Do it very gently at first, and I mean, we always want to do it gently around this area, but in particular at the beginning, very gently. What I would recommend doing along the jawline is just taking some non-greasy massage cream, and I would just kind of go along the jawline with the massage cream. We just want a little glide as we do some work up in here, so that we're not sticking on the skin because we're using our knuckles. So just get a little light massage cream, nothing too oily. You never want to use oily when we're doing fascial release work. You don't want to be slipping and sliding, but just something to give a little glide to the tissue. Okay, so first off, we got the temporalis. We're going to take our knuckles of our fingers and just nice and easy, and you could see from the anatomy before, this is a pretty good sized muscle. It covers a good surface of the side of the skull here. And we're going to just back and forth 30 seconds to 40 seconds. I'm just kind of massaging out that temporalis muscle, and we're getting a ton of blood flow through here, nice and easy, 30 to 40 seconds. Then we're going to come down with the knuckles and right on the masseter, same thing, 30 to 40 seconds, just back and forth, nice and light, and get some blood flow in that area there. Just doing that alone, I mean, I didn't even do it for a full 30 to 40 seconds just to keep things moving here. I mean, but it feels awesome. I mean, if you have tightness or tension at the end of the day or after a workout of these muscles, just stimulating those two muscles alone, I mean, it feels really good. So just give that a try. Okay, so we did some work here. We did some work on the masseter. Now just with the knuckles again, just go back and forth from the beginning of the mandible to your chin, back and forth along the jawline, about 15 to 20 times with some, relatively light light pressure, a little bit of firmness, just to get the blood flowing right back and forth like that. And then with our thumbs, kind of go a little bit underneath the jawline, back and forth 15 to 20 times. Once again, both of these motions, I mean, it just feels so relaxing, so awesome, just getting the blood flowing through the tissue like that. I mean, think about it. When just a little self-massage on any part of the body, I mean, it's always going to feel good. I mean, right now, I feel like I got a ton of blood flow through there. So if I was someone who just came home from work and I was all tense and stressed from being at my desk all day, I mean, just sitting down and spending a couple minutes doing that, I mean, if you had tension, it's going to basically go away. And it should definitely give you some relief. But anyways, that's just the start of it. We did some of that soft tissue work. Now we're going to do a little release work. As we talked about, the temporalis and masseter, close the jaw up. So what I'm going to do with my knuckles, I'm going to nice and easy, I'm going to put pressure on it, and I'm going to press an upward direction like this. Now as I do that, I'm going to go from a closed position to an open position with my mouth. So I'm going to put pressure, Just like that. Now, how funny is that for a video? But anyways, I'm going to slowly draw my knuckles up the temporalis as I slowly open my mouth. And I'm going to do that 10 times. Then I'm going to come down on the masseter. And the same thing, I'm going to put my knuckles on the masseter nice and easy. And I'm slowly going to draw them up towards up the skull like this. And as I do that, once again, going to open up the jaw. I'm going to come down again. We're going to do that 10 times. We're going to get a release. So basically, those muscles we're trapping and pulling on the tissue this way. And as I'm pulling on that tissue this way, I'm opening up the jaw. So we're going to slowly, nice and easy, kind of just get a release on that tissue that's all bound up in there. And we're going to gently pull it apart. Once again, feels awesome. So 10 times on the temporalis, 10 times on the masseter. Now we're going to go through some just gentle ranges of motion with the jaw. Now remember, we're not looking to do exercises. The masseter and temporalis are the muscles that we're using a lot. We're overusing them. The one muscle, the primary jaw opener, is called the lateral pterygoid, and that's the one that opens the jaw. We're going to do a little work with that one to get some stimulation in that muscle, because that muscle's not used that much. I mean, you got to look at the joint no different than, say, any other, the jaw, no different than any other joint in the body. You always have an agonist and antagonist muscle. So, in other words, we get your bicep and your tricep. So the bicep flexes the elbow, the tricep extends the arm. We don't want the bicep to be overused and the tricep to be weak, or vice versa. We want to keep things balanced in the body with our antagonist and agonist and antagonist muscles. And it's the same thing here. We tend to, because we're chewing, we're tense, we're clenching, the clenching muscles, the temporalis and the masseter, get overworked. The lateral pterygoid that opens the jaw is barely used. So keep that in mind as we go through some of this stuff. So first off, just some gentle ranges of motion. We're going to go 10 times for 3 sets of just opening up the jaw nice and wide and coming back nice and wide. So we're going to do that 10 times. We're going to do 10 repetitions for 3 sets. Then we're going to do the protraction 10 times. We're going to do 3 sets of this where you just nice and easy. You're just going to be jutting the jaw out. And then, once again, we're going to do 3 sets of 10 repetitions of just side to side. Just to get the jaw moving, get some range of motion, get some of those muscles that we don't usually work on, just to get them activated. It's going to feel good. You know, if you have no jaw trouble, it feels, you know, probably like, oh, that's a silly thing to do. But if you have a tight jaw, it actually, you'll know that those movements are going to help. It's going to relax the jaw. It's going to get some blood flow into different tissues. Now that we've done that, we're going to do a little extra work with that lateral pterygoid, which is the muscle, as I said, that opens the jaw. We're just going to take our thumb or both thumbs underneath the chin, and just with some gentle resistance, open the jaw against the resistance. Once again, 10 times, do it for 3 sets, just very gentle resistance on it. If any of those motions are giving you a lot of pain, don't do them. Once again, contact your doctor. But we always want to be working through a pain-free range of motion with those different things. So there we go. Fascial release work, working the muscles that are involved, the main muscles that are involved with the jaw, the temporalis, the masseter. We did some release work on that. Basic ranges of motion, we did some of that, and then a light resistance exercise on the lateral pterygoid muscle that opens the jaw. You know, if you're having some chronic discomfort in the jaw, this isn't a quick fix, but start doing it every other day, nice and easy, and spend a few weeks working on it. 2 things. That was number 1. Do some work every other day, just like I showed you on those fascial release work and the exercises. But number 2, which is the most important thing, is find out what you're doing during the day that's causing it. So are you clenching at the desk? If you are, be conscious of it and stop doing it. Are you clenching in the gym, during bench press or during it? If you are, you got to put an end to it. It doesn't do you any good to go through all this fascia release work and all these little exercises if then you're going to go back and do the same exact thing day after day. You're going to be taking 2 steps forward and 2 steps back. So find out what's causing it and then give it some work. I think you're going to find that stuff really helpful. I hope it really works out for you. I hope it helps. Nothing's worse than TMJ discomfort. Alrighty. Exercise programs, mobility plans, our new shock release instrument, all available on my website, www.OcraMedHealth.com. If you're enjoying these videos, please subscribe to my channel, OcraMed Health on YouTube. Questions about exercises or injuries, just leave a comment in the comment section below. I always write back to everyone who writes in, unless you're writing in really nasty remarks and I just block you from the channel. Only kidding. And don't forget, OcraMed Health is here to keep you fit forever.